100 children have died in the United States this flu season. That's more than any year since the swine flu pandemic 15 years ago. According to the CDC, there were 216 pediatric deaths, surpassing last year's total of 207. Joining us from Stanford Children's Hospital, pediatric infectious disease specialist Dr. Aslam Khan. Thank you for being with us.
Thanks for having me.
What do you think's behind this drop in deaths?
So in general, I think we've been seeing a decline in influenza vaccination uptake. Since the COVID-19 pandemic, I think every year across the country, even in the Bay Area, in the state of California, we've been seeing decline in vaccination rates. And we know that vaccination is probably one of the key prevention measures for influenza. And unfortunately, this has just been a very severe season of influenza where there have been numerous pediatric deaths, including here in the Bay Area.
I know I started seeing the signs at like CVS well before Halloween. At this point, is it too late to get a flu shot?
I think in this point of the season, we are getting to it's tapering down. And so there are less cases in general. I think for protection, if someone who's never received a flu shot, it is important to get. But going into next season, for sure, that is something to anticipate before the season fully starts. We usually recommend influenza vaccine starting the fall, sometimes available as early as September. And so that would be something to consider for everyone, especially even if you've had a case of flu.
I know my son's elementary school used to do a Shoe the Flu, where basically everybody would line up for a flu shot. Do you think people take the flu seriously enough?
I think it's one of those that's kind of in the background of people's minds. You know, even a part of the vaccination schedule, a lot of people argue, like, I'm not high risk, so maybe I don't need it. But the idea of flu in general circulating in the community, the less cases are probably the best way to prevent is by vaccination. And so especially if you have high-risk contacts, it is something to keep in mind: young children, elderly, immunocompromised. And so us as pediatricians often recommend, and I do think, unfortunately, some individuals may feel like this one is not as important, but it is important to note that we do have annual deaths. We saw the severe amount of deaths this year, and it's something that, you know, potentially could be prevented.
I was talking with friends about 5 years ago at the beginning of the pandemic. I think the first time we all sang like row, row, row your boat while washing our hands, we thought this feels like forever. And we were so good for a couple of years, but now, you know, hand washing, you know, coming to work a little bit sick, I think we've sort of backed off on some of those best practices. How can people best protect themselves?
Yeah, so I think hand washing, hand hygiene is a key step, especially even for children going to school before eating, you know, just trying to prevent touching your face. If you haven't washed your hands or you're in public spaces, that is one key. The other is just, you know, obviously, if there are people who are known to be sick, to kind of just try to isolate your way away from them. Sometimes it's very challenging, obviously, in close contexts in households. And then the other is prevention as much as you can. So, you know, recommending that immunization into the next season.
Absolutely. We'll mark it on our calendars now. Thank you so much for joining us, pediatric infectious disease specialist Dr. Aslam Khan from Stanford Children's Hospital. Thank you.
Thank you.